Thank you for being here. We will move on to Texas Tech Health Science Centers and call up Lori Rice Spearman, President of Texas Tech Health Science Center. And Ms. Spearman, you may proceed. Thank you for being here.
Good morning, Madam Chair and committee members. I'm Dr. Lori Rice Spearman, President of the Texas Tech University Health Sciences Center, and thank you for your ongoing support and investment in our great university, including the funding to build upon telehealth initiatives provided in the 88th legislative session. I am grateful for this opportunity to discuss our legislative appropriation request with you today. Our HSC is committed to meeting the medical needs of more than 10 million individuals across 121 counties in the Panhandle, West, and North Texas regions. For over 50 years, our university has played a vital role in training healthcare professionals and expanding access to care. Recent data from the Texas Higher Education Coordinating Board highlights that our HSC's leadership and healthcare workforce development. Across our 6 locations, we produce about 24% of all degrees and certificates awarded from health-related institutions in the state of Texas. As a comprehensive health sciences center, our mission is simple, and that is to ensure Texans have access to high-quality health care. We are dedicated to transforming healthcare through innovation and collaboration in our communities. We address challenges through workforce development and provide critical resources for healthcare expansion via our institutes, programs, and research. I want to share with you some statistics. Compared to their urban counterparts, rural residents face higher mortality rates from heart disease, respiratory disease, cancer, stroke, and unintentional injury, the 5 leading causes of death in the United States. Additionally, rural residents experience higher maternal and infant mortality rates and greater prevalence of death by suicide. A stark disparity exists in life expectancy. An individual in a county in the Panhandle lives an average of 17 years less than someone in a county north of Dallas. Your zip code should not determine your life expectancy or your health status. Texas Tech University Health Sciences Center legislative appropriation requests and priorities reflect the investments necessary to address these challenges. Advancing technology and research are essential to both our academic mission and the care delivery infrastructure. Our priorities build upon this foundation to expand access and improve quality of care, particularly for rural Texans. Formula funding is imperative to sustain academic instruction and our graduate medical education funding. We appreciate funding for growth included in the introduced bill and look forward to working with you throughout the session to look at investments in the formulas to address inflationary costs. For our exceptional item, our top priority is the establishment of the Rural Cancer Collaborative, a first in the state of Texas. The request detailed on page 3 of your slide is for $50 million for the next biennium to build upon RHSC's existing cancer research and clinical infrastructure. Rural Texans face significant barriers to cancer care due to a lack of diagnostic infrastructure, limited access to specialized treatment, and underrepresentation in clinical research. RHSC is committed to addressing these disparities by expanding access to screening, treatment, and clinical trials through partnerships with our rural hospitals, mobile screening clinics, and continued expansion of our telehealth. When it comes to cancer, time matters. Distance should not determine your survivability. Early detection and timely access to appropriate intervention saves lives. Our Rural Cancer Collaborative will bring prevention resources and cancer care closer to home by leveraging our hospital partners and expanding clinical trials in underserved areas. We have identified 3 pillars: expanding early detection and prevention, expanding integrated treatment and care, and expanding clinical research and data analytics. Through this investment, RHSC will increase access to life-saving care for our rural Texans, thereby stabilizing and securing the workforce of the future, not just in healthcare, but in oil and gas and agriculture as well. Other requests can be found on page 4, and that is a realignment of our mission-specific formula. RHSC seeks to realign its mission-specific formula to better reflect who our university is and what we do, related to enhancing rural healthcare access, cultivating a highly skilled healthcare talent pipeline, and expanding research capabilities. If capital construction assistant projects are authorized this session, our HSC will request authorization for our Amarillo Master Plan to expand our capacity to serve the region. Our HSC remains steadfast in its founding mission to improve access to care for a historically underserved population. We are dedicated to transforming healthcare through innovation and collaboration in service to our communities. Our health disparities between rural and urban Texans continues to widen. Our HSC plays a critical role in strengthening rural health delivery, research, and workforce. Our leadership in addressing these challenges not only benefits regional economies, but also ensures that quality health care remains within reach for all Texans, again, as your zip code should not determine your access to health care. Texas Tech University Health Science Center is deeply grateful and thankful for your support. Our team looks forward to working with you throughout the legislative session. Thank you, Madam Chair.
Thank you. Senator Perry.
Thank you, Madam Chair. Kind of go back to your exceptional item request, Rural Council Collaborative. So to be true, there's 2 hospital systems that are working in conjunction. We have a whole new facility. One of the hospitals is built largely by private money.
Correct.
As a cancer focus for that region, correct?
Yes.
This would be a collaborative effort in that initial. We're a big state, Madam Chair, and we sit in a state that has the best medical district in the world, specifically to cancer down in your area. That's 10 hours away from Lubbock.
Yes, sir.
We have another initiative over in El Paso that's working on the same kind of initiative. That's 6 hours from Lubbock and probably similar distances. The best facility in the world that's not accessible is no facility at all.
You are correct, sir.
I appreciate the partnership and your data and your work into that, but again, it goes back to this is not a all in your back, and the communities, I think, are regionally. We serve a million people. Lubbock's a hub. We serve regionally. And it's that cancer treatment that every day you come across them when they say they're trying to get into MD Anderson, that hopefully you'll have a response that we don't have to go to MD Anderson if we follow through. So thank you for your work on that.
Thank you, sir.
Senator Colcourse.
Thank you, Madam Chair. We had a discussion about GME
ma'am.
slots, and I had a bill last session, Senate Bill 458, that was addressing this exact issue on rotational spots for nurses. Are you seeing, it passed the Senate unanimously, and are you seeing this where other states or systems are bringing in their own students, displacing clinical rotations or GME slots with their own to put out in other states to work in their system?
So our challenge right now is because of the situation that we have of a greater number of residents than we do slots here, external individuals outside of the state of Texas or for-profit entities come into these hospital systems and pay for their residents to be able,
100%,
yes,
absolutely.
be able to come. And so, yes, it is having an impact.
And so then that's a displacement. We're paying for GME slots. We're actually paying, I saw it in Victoria where there was a hospital system and they were going to pay a hospital for the rotational slots for ADN nurses.
Yes.
And this was going to have a direct impact. And it's really an issue we have to address as a state.
Yes, Senator. We see it both in physical therapy, physician assistant programs, medical education. We are seeing this across the complement of all the health sciences.
So, Madam Chair, I know Senator Hinojosa is going to work on this, and we'll work on the GME slot, and we'll also work on the clinical rotation slots as well, either as 2 separate bills or one big bill, and I'll work with you, Senator Hinojosa.
I also want to thank for Senate Bill 25. We have the largest undergraduate nursing class that we've had in the history of the Health Sciences Center this year, and we are utilizing those dollars wisely. Thank you.
All right, that's all the questions. Thank you.